Hi, I'm Wilfredo Garcia Beltran. I'm a second-year clinical pathology resident here at MGH, and I encourage you to come here to this program. When I first started here, I was very impressed with how the program offered me many opportunities to develop many interests. I actually come from a research background as well as a physician background, and in this program I was able to develop all of those interests. I'm working in the lab the last 2 years, working here in clinic, seeing patients in the blood bank, and just in a month I'm about to start my fellowship as a transfusion medicine fellow, thanks to the faculty here who helped me get there.
My name is Nidha Safdar, and I am a fourth-year APCP resident. My 4 years at MGH have been incredibly busy, but also the most rewarding and fulfilling years of my life. I have had the opportunity to learn pathology from world leaders in every field and benefit from their mentorship and guidance. In thinking back to my most memorable experiences in residency, I would have to say most of them involved my time as a senior resident in the frozen section lab.
Hi, I'm Tyler Miller. I'm a CP-only resident just finishing my second year. After 2 years in the program, I can pretty confidently say that we have one of the strongest CP-only residency programs in the country. Not only do we have really complex and extensive labs that we get to experience, but our faculty also invested in teaching us clinical lab medicine. We have a good balance of both clinical workload and being able to explore our own research interests. As most CP-only residents, I have a PhD and I'm very interested in research. Most of our faculty members also have a PhD and are interested in research, and so they understand and support our research interests. They also treat us as colleagues. They value our scientific knowledge and they seek out and integrate our input on cases and projects. For example, along with a lot of my other CP senior residents, I helped lead the rapid development and validation of our COVID-19 assays. Our residents were really critical, both intellectually and experimentally, in launching these assays for our patients and for our community.
Hi everyone, this is Zehra. I am one of the molecular fellows, and prior to this I did my AP and CP training as well as my OBGYN fellowship at MGH. So back when I was trying to pick a residency training, I knew that the major programs will always give high quality training. So what I was looking for was the atmosphere and how I feel with people, because these are going to be the people I will work with for at least 3 to 4 years, if not more. And I can say that at MGH, I found my niche. I made amazing friends and we had lots of great memories together. I watched them having kids, including myself, getting married, and we had a good time at work and outside. We also have attendings that are easily approachable, and I had my own mentors for my own subspecialty. But in addition to this, I asked many attendings advice about professional and personal life, and they always had an open door. And I can say that at MGH, we had at the pathology department, we have one big family, and if I could go back in time and do this all over again, I would still choose MGH.
Hi, my name is Bianca Christensen and I am an APCP second year. I really enjoy working with and getting to know the amazing support staff that we have here, both on the AP and the CP side. Even on a really difficult, challenging grossing day, I have a ton of fun upstairs with the PAs and the techs chatting about our favorite Boston eats, the podcast episode that we just listened to, and how adorable our cats are. We actually even have a group chat with some of the PAs, the techs, and also some residents where we just swap pictures of our cats. And they have really truly become my friends here, and I really enjoy coming to work every day and seeing them.
Hi, my name is Sam Champion and I'm a PGY3 in the AP-NP program here at Mass General Hospital. And I came to Mass General because I knew that the program was excellent in training for both anatomic and neuropathology. But what I didn't realize until I got here is how it provided such a supportive environment. Not only do you get close to your co-residents, but you also get really close to the PAs, to the technicians, and your attendings that train you. You have so many opportunities to learn new things, but even if you're unsure about something, and even as you get more senior, there's always someone there to help you. You are never alone. And an added bonus is you get to live in the city of Boston, which is a runner and walker's paradise. You can get anywhere on foot, and there's always some place or some historical monument or plaque that you can stumble across when you're exploring Boston.
One of the things that really attracted me to the program here was the degree of support and the sense of community in the program. Even before I moved to town, a couple of the second-year residents helped me find housing. One of them even spent a whole morning driving me around the city so I could look at different housing options, and that was very helpful in terms of finding a place to live. Our sense of community within the residents here has been maintained despite the COVID challenges. Tomorrow morning, just as an example, we're planning to get together with a couple families and take our kids strawberry picking, which we can still do as long as we stay a few strawberry rows apart.